We all suffer cuts and scrapes, but for some people, healing is harder to come by.
News 13's Victoria Dunkle is streaming live from Pardee Hospital. Victoria, we understand they're seeing some impressive success rates for healing wounds.
Yeah, they really are. When they compare the basically a month stretch, it's 27 days or 31 days, to the national rate, they have a 98% success rate here at the Comprehensive Wound Care Center at Pardee Hospital. And it's because doctors like Chuck Albers are watching with the patients when they come in here and present with a condition. Now, tell me some of the patients when they get here, who is coming to see you for this kind of help?
In general, we see folks who have chronic non-healing wounds, wounds that for whatever reason aren't healing, and either they get tired of it or their physician says something isn't right. Occasionally we'll see acute wounds, the little old ladies who are getting on the bus at the retirement center and slip on the steps and scrape their shin. And we know, or the ER doc or the urgent care doc knows, those are going to be trouble healing. So we'll see those as acute wounds.
What about the treatments that are available? We're here in the hyperbaric chamber room, and this is one of the really state-of-the-art approaches to treating it. What are some of the steps? Does every patient end up in here?
No, absolutely not.
Okay.
What we look at is why the patient is not healing. The usual course of events with people is you get an injury and you heal. And if they don't heal, what's the problem? So we go through a multi-step approach looking at, do they have infection? Do they have ischemia? Is there poor nutrition? What is wrong with the picture? And then fix whatever the problem is. And that may be if they have ischemia, if they don't have enough blood flow, sending them to the interventional radiologist or the vascular surgeon for a bypass or a stent, and if there's infection, treating with antibiotics.
Quickly, you mentioned that there are some things that, maybe nutrition and so on. Obviously, if we're a diabetic, we have certain guidelines we need to follow and so on. But is there something that the basic person can do to improve their chances of being a good healer?
Increase their protein intake.
Really?
Okay. Have a good diet. A balanced diet that has all the good stuff in it. Occasionally, patients will have problems that need hyperbarics. Hyperbaric oxygen is not for everyone, but if they've had radiation injury, if they have bone infections, if they have ischemia that can't be reversed by vascular surgery, this sort of thing, then we
bring them here.
Come here, yes.
All right. Coming up in our next half hour, we're actually going to be in this chamber to see what it's like. Reporting live in Hendersonville, Victoria Dunkle, News 13.
With diabetes rates going up, so is the rate of people needing treatment for chronic wounds.
News 13's Victoria Dunkle is streaming live from the Comprehensive Wound Healing Center at Pardee Hospital. And Victoria, it isn't just diabetics getting help there, right?
No, not at all. In fact, earlier we were talking about who all can benefit from this type of treatment. And it is people who are diabetics and who may have chronic wound issues, but also cancer patients and some other patients who suffer an injury that just doesn't want to heal. And I'm talking to Paul Martin here because you're the one that everyone gets to see when they come here. You actually help people with this process of going into what do you call it?
Hyperbaric chamber.
Hyperbaric chamber. Okay. I'm going to go in for a little bit of a ride. We're not going to turn it on because he wouldn't be able to hear me over the microphone, but give me an experience of what it kind of feels like to go in here and tell me what happens when the patient comes inside this chamber.
Well, when you're inside there, you're going to be subjected to twice the pressure that we're all subjected to right now with 100% oxygen, which doesn't seem like a whole lot, but that actually saturates your plasma with 10 to 20 times the amount of oxygen that we have in it right now. So it can really help to contribute to the healing of a wound.
Can you push me in just a little bit further and let me get a feel for whether, I mean, some people are claustrophobic. He's like, yeah, here we go.
It's not too bad because you can see all the way around you. You can move as much as you want.
Okay, yeah, it is quite comfortable. It does sound a little different, obviously, but they've got TVs and all of that. What's going to happen when that oxygen comes into my system?
Well, it's going to obviously go into your system. It can do a lot of things. It can kill anaerobic bacteria, and it causes what's called angiogenesis, which is actually the regrowing of blood vessels where you didn't have any before, and that contributes to the healing as well.
Regrowing blood vessels? I mean, that help the body, I mean, just completely regenerate? Is this like a fountain of youth to some extent when it comes to our bodies?
In a way it is, yeah.
Wow. How long would I be in here?
You're going to be in there just a little under 2 hours.
Okay.
And that's every day, Monday through Friday, anywhere from 20 to 80 treatments.
Well, as you bring me back out, tell me how soon I would be expecting to see and feel a difference.
Depends on the wound that you have, but you can see a difference within a week.
Wow, incredible. And it's right here in our own backyard. Access to this really, truly healing process.
Yes, ma'am.
Wow, coming up, we're going to find out how the patients are reacting to this, what their take is on a trip into the hyperbaric chamber, and how it's improving their lives. Reporting live in Hendersonville, Victoria Dunkle, News 13.
It's fascinating, isn't it?
It is fascinating. Probably helping lots and lots of people. It's great.
No doubt about it. From diabetes to cancer to injuries that just won't heal, finding a treatment for chronic wounds is critical.
News 13's Victoria Dunkle is streaming live from the Comprehensive Wound Healing Center. And Victoria, what are they doing there that has patients so excited?
Well, they're using one of these. This is a hyperbaric chamber. I was just inside there in our last live shot, and what it does is it gives an intense infusion of oxygen that really is what our body can use to help heal. In fact, well, Ann Campbell is one of the, you run the clinic here, you work with the patients, you talk to them about this, and explain how you get them comfortable with this idea, because it does seem kind of a little sci-fi on us here.
It is, and what we do is we educate our patients. We go through a list of questions that they get to answer, and we allay any of their fears, and we will put them in if they need to go in and check it out to see what they would like to do. And we include the families. We include husbands and children if they want to come, but we include the families in the education about the hyperbaric chambers.
And earlier when I was talking to Paul and Dr. Albers about this, it was a situation where this actually helps the body really speed up the healing process. What is it the patients tell you when they're done?
Wasn't any big deal. They don't feel anything. That's the biggest question that we get is, how does it feel? Do you feel this going on? And they don't. You know, they get to lay there and take a nap for an hour or 90 minutes and watch TV.
That's not bad.
Yeah, it's not bad.
And it's leading to incredible success rates. You're seeing people have their chronic wounds healed.
Yes.
And what's the feedback? I understand that you're doing pretty well compared to...
We are. We have a 98% healing rate and a 98% patient satisfaction rate. And we're very, very proud of that. We work very hard to create a positive atmosphere here in the clinic. And it works. It's a great thing.
It definitely works. In fact, everyone's been smiling since we've been here since about 4:30 setting up. But this is incredible that we have this access right here where we live, because with the growing numbers of diabetic patients and other issues like cancer and other chronic wound issues, people really can make use of this.
They can.
All right. If you want to find out more, we'll hook you up with a link to Pardee Hospital's website on our website, WLOS.com. Click on more info. Reporting live in Hendersonville, Victoria Dunkle, News 13.
More than 25 million Americans have diabetes, and at least 1/4 of them will suffer from chronic wound problems. That's where this machine can come in to help. It's a hyperbaric chamber at the Comprehensive Wound Healing Center at Pardee Hospital. Along with diabetes patients, cancer survivors, and people with chronic wounds take a trip into the tube for a super dose of oxygen. The treatment delivers 10 to 20 times the amount of oxygen we normally breathe. It kills bacteria, stimulates blood vessel regrowth, and reduces swelling.
Generally, they love it. They think of it as their spa time. They come in here, they get to relax. They know that they're doing their wounds some good. They love it.
Last year, Pardee had a 98% heal rate with patients, and those patients reported a 98% satisfaction rate with their treatments. You can find out more at WLOS.com. Click on More Info.